Hello. Now today's video will be about my 1 month experience in ICU. So, I'm working in ICU for the past 1 month. I've just completed my BSc physician assistant course in June. Sorry for any kind of like mispronunciation because I'm wearing a splint in my mouth. So, I'm still, it's just been like 3 or 4 days since I started to wear this splint, so my words are not that clear yet. I'm practicing, so sorry for the words. I'm sorry. So, what I've learned in this 1 month in ICU is that there are two ICUs in our hospital. One is medical, and the other is for coronary care, that is related to heart. So, I am working in medical ICU for the past 1 month. So I joined in June 15 and today is July 15. It's been correctly 1 month. The things that I've learned is that so many, I can't really like it. Lot of thoughts are coming in my mind. I'm shooting like filming myself in scrubs because I just came now. Took like 5 minutes of break and I started to film because I have other work to do next. So the first thing is, life is very very unpredictable. I have seen patients who are very young in their early 20s to very very old patients who are in their 90s. I have seen both the range, so I can really tell that life is very very uncertain. You can never predict anything that could happen in the future, and so health is very very important. And I am starting to realize that we should take care of ourselves. And but the irony is, I'm in medical field. I can't really do much during my shift, but the other time I try to take care of myself by eating well, sleeping well. The one thing that affected me a lot is water. I can't drink much water because first thing is, you don't get time to drink water. You don't get time to take break intervals. You don't usually, you don't, because there will be a lot of work. There will be doctors rounds, there will be some procedures going on, so you can't really have a fixed time to give yourself break. That I couldn't have. The second reason is, there will be extreme cold in the ICU, that if we drink a lot of water, we have to go to the restroom every 2 hours. That would be the case. So drinking water has not been in my schedule for the past 1 month. I should change. I think I will try to change. And then my relationship with my colleagues. There are nurses who work there, and I think I have maintained a proper workplace relationship with them. I don't usually share my personal things, or I don't usually ask their personal stuffs. I just keep it very very professional. I try to be. I have kept like that for the past 1 month, and I have not faced any problems regarding this, the relationship between the colleagues. I have not. And even with the consultants, I am not the kind of a person who will just go and like kind of beg them, or be like trying to get a good name being their pet. I was never like that. Even during my school days or my college days, I always like, I just minded my own business. I never really want to be anyone's favorite. I just do my work. I learn things. I improve. I try to get better. Once my shift timing is over, I leave. But sometimes there were times that I had a lot of work that I had to stay for another 1 hour. My shift timing is 8 to 4, but sometimes work will be there, so I had to remain till 5 or 5:30. I completed my work and then I came back home. So it's not to get a good name from anyone, but to just be like, work is there. No one is going to do my work if I leave. So I will just finish and then I will leave. So I think that has been my mindset from the beginning. I think I have to continue this mindset being like this, that I don't want to get someone's good name or to be someone's pet. I'm just minding my own business, because I don't want to. I'm not into the phase that I need to impress someone and get good name from them. No, I'm just minding my own business. I'm protecting my peace, and that's enough for me. What else I have learned? Actually, sometimes I feel like I'm not that good enough, or I'm not doing much, because for the past 2 3 days there have been a lot of patients. Literally from 10 to 11 patients are there in ICU. The total occupancy of ICU is 12, and right now it's always in two digits. So there are a lot of work to for me to do the summaries. I've been stuck with doing all those summaries. So that has been really difficult, because I always wanted to go learn in patient side, and learn procedures, learn about the physiology, what they are doing, what are the problems that the patients are facing, or the physical examination, or any kind of diagnostic procedure that they are doing. I really wanted to go and observe, but since few days I'm not getting any chance to do that. I'm just sitting in the chair and I'm just typing the summaries. I feel bad. But today my associate consultant said, like, only during the afternoon you are supposed to type summaries. In the morning you have to go for rounds and see the patient side, what are the procedures you are doing. You should not sit at the morning, she said. So I'm going to do that from tomorrow onwards. I wish I could complete at the same time all these summaries. mm, what else? At the beginning days, during the early days, I felt so bad going to the work, because I didn't like it at all. I got my scolding in the first week itself from my chief consultant. He scolded me so much in front of everyone. The entire ICU went silent, and only he was speaking. Not speaking, he was actually like shouting at me. That was my very first experience in ICU where I got a lot of scoldings. That's why I'm saying I don't want to be a pet of anyone, because during the tough times you get to see the people's the bad side actually. So I think right now I'm like in the kind of mindset, if someone is good to me, I want to be in a very like, okay, fine. If someone is bad to me, if I can change that, if I can speak up to them and say, hey, this behavior is not good, I don't feel good when you behave like this to me, please don't do this. If I have that kind of um, a position, then I will. If not, if I'm very very under them, then I don't do that. I just leave. Okay, fine, they have some kind of an angry, and they're just showing it on me. I know it is bad, but this is how healthcare professional works. It's just the hierarchy system, that where you are positioned, you're gonna get a lot of scoldings from the people that who are above you. That is there in this healthcare system. And what else? So since I got the ICU job directly after I completed my college, through my college interview, my plan is to continue this job for 1 year, because I have my hospital near to my house. It just takes me like 5 minutes in two-wheeler to reach my hospital and to come back. So I don't really find any difficulty in transport to commute to my hospital. I don't find it difficult. But my mind is like, I want to try surgery. This is a medical ICU, not surgical. So I wanted to try surgery in future, because I'm so bad at it. I have a few stories to share. I will do it in the future, because I had few experience in surgical, very bad experience. That's why I feel like I want to try surgical and be good at it, because I sucked at past, and I will tell you in the future as well. So this is how this is how my ICU time was for the past 1 month. So let's see how time goes, and I just want to give my best. That's it. Tata, love you all, bye. Mwah.